Hello, everyone. Thank you so much for joining us for today's webinar. Our topic today is Proud and Empowered, a school-based intervention for LGBTQ youth coping. This webinar is being recorded, and the recording will be available to access in the Innovations Learning Management System in the coming weeks. All participants have been automatically muted. If you have any questions, please use the chat box to post them at any time. We'll answer as many questions as time allows at the end of the webinar. Please make sure when you are using the chat function to set the to line to everyone. This will ensure that everyone who has joined us today can see your message. If you experience tech issues at any time, please use the chat to let us know. Please go ahead and use the chat to introduce yourselves. Let us know your name, your pronouns, your organization, and where you are joining us from. After the webinar is over and the Zoom room is closed, a brief webinar evaluation will automatically pop up. Please take a couple of minutes to fill this out. Your feedback helps us improve our programs, and we really appreciate hearing from you. For those who wish to receive continuing education credits, you must first mark attendance before you can access your certificate. This will take a few business days, so thank you in advance for your patience. In the meantime, we encourage you to log back into Innovations and take the post-test after this webinar is over. Once you pass the post-test and attendance is marked, you will receive an automated email inviting you to download your certificate. Next slide, please. This is just a slide saying the views, opinions, content expressed in this presentation don't necessarily reflect the views, opinions, or policies of the Center of Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Next slide, please. This webinar is brought to you in a partnership with the Center of Excellence on LGBTQ+ Behavioral Health Equity and the Mental Health Technology Transfer Center Network Coordinating Office. And next slide. Center of Excellence on LGBTQ+ Behavioral Health Equity, funded through a grant from the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, is designed to support the implementation of change strategies within mental health and substance use disorder treatment systems to address disparities impacting the LGBTQ+ community. And you can check out more about us and upcoming webinars at lgbtqequity.org. Next slide. And so now I would like to introduce our speaker. We are so pleased today to have Dr. Jeremy Goldbach, PhD, LMSW, with us today. And Dr. Goldbach is a Masters and Johnson Distinguished Professor in Sexual Health and Education, Brown School at Washington University in St. Louis. Thank you so much for being here today, and now I'm going to turn it over to Jeremy. Thank you so much.
Hello, everybody, and thank you all for joining me in my home office today here for the next hour or so. I know it's maybe morning in some places, afternoon in other places, so I'm excited and thankful that you all took the time to come and join us. I know folks have been putting their information already in the chat, and so it's been nice to be able to follow along and see where everybody's working and the type of work that you all do. Again, really thankful for you taking the time out of your day to join us here today. So I'm going to do a couple of things, or I'm hoping that I'll do a couple of things. We'll see how it goes for you. I want to spend just a few minutes real quick just doing some baselines in LGBTQ Youth 101. I know that many of you in the room, this may be very familiar for you. For others, it may be brand new. So I just want to take a moment to just go over a couple of things around understanding queer and trans youth. The second thing I'm going to do is tell you a little bit about the research and the development of Proud and Empowered, the intervention that I'm going to talk to you about today that we've been working on for about the past 12 years or so, which is now in its second round of testing through clinical trials. So I want to talk to you a little bit about the background there, just to give you a sense of how we emerged. The third thing I'm hoping we'll do is go through the actual curriculum briefly, just to share with you Proud and Empowered, how the sessions sort of work. And I'll talk last about the social norms component of P&E, which is called Make Space, which takes some of the work that's done in the small group, more supportive sessions, and allows youth as well as some their peers to bring that into the school environment and try to actually change the systems that created some of the challenges for them in the first place. If there's any problems with that list, I'm sorry, I don't have time to update the PowerPoint now. So hopefully that works okay. And I know I can't see you all shaking your heads at me from my terrible dad jokes, but I do have a 9-year-old who gives me plenty of negative feedback, so it's fine. So just to start, I just want to make a couple of quick distinctions here. Something that I think is important is for us to understand, we're thinking about sexuality and gender experiences of queer and trans and non-binary folks. It's important just to make mention that sexuality and gender are not the same thing. They are really two separate but interrelated constructs, and all of us get to have both, which is really cool. So our sexuality is really focused on who we're romantically, physically, or sexually attracted to, or perhaps not attracted to. For some folks that are not attracted, don't find themselves attracted to others at all, falling on that asexuality spectrum. And then separately, but related, gender, which is made up of our individual's understanding of our gender expression, identity, and the gender that was assigned to them, or the sex that was assigned to them at birth. These are really complicated constructs that we don't have, a lot of time here in this hour to go through. I show the Gender Unicorn. This is a great website that I found helpful, and at least, especially for folks who are unfamiliar with all of the varying aspects that make up our identities and our gender identities in particular. There's a lot of things that go into this. Some of these are things that can be, seen when a baby is born, and we say, "Oh, that's how we make our decision." There's a whole lot of things about even sex that's assigned that's a lot more complicated than that, right? And then as we grow up, our understanding of our own gender is an evolving and ever-forming construct, really from birth till death, or cradle to grave, as they say. And our own understanding of how we fit, how our gender fits in the world, is evolving. Historically, one of the ways that research has been done has really been around where we just say LGBTQ, right? We sort of put everybody together, and I want to make mention that most of the research that I'm going to talk about today has looked at sexual minority adolescents, and then separately trans and non-binary adolescents, and at times intentionally both groups together. And that work has culminated in and sort of contributed to the development of Proud and Empowered, which has been explored in both queer and trans, or queer and trans adolescents, both in some community sites as well as within schools. So LGBTQ plus, a lot of identities that fit within this. More recently, we're seeing the term queer become popularized again. This has historically been a derogatory term, and so some folks really don't love this for themselves. Other folks have started to reclaim this word, see it as empowering, and often self-identify as queer. So umbrella terms for people who are not straight and cisgender, some folks will say queer, or in an effort for visibility, I tend to use the say queer and trans. So just to talk a little bit about why do we need interventions? This may not come as a surprise to some on the line, but this may be somewhat new. We see a lot of disproportionate risk in mental health and substance use, as well as other types of health outcomes like HIV and sexual health for LGBTQ adolescents, both queer and trans folks. So we see 3 to 4 times the rate of internalizing disorders. These are things like depression and anxiety, PTSD symptoms, and about 2 to 5 times the rate of externalizing symptomology, including in behavioral, more general behavioral health, as well as substance use patterns. And there really aren't a lot of interventions that exist for use with queer and trans adolescents. Couple that I'll just mention quickly. Affirm is one that is a CBT focused intervention. I think that there's been a number of webinars that through the Center of Excellence as well on Affirm. A really great evidence-based, evidence-informed intervention using a CBT framework. tending towards more folks that are trained in CBT, and that, and appropriately. Separately, we have Family Acceptance Project, which has been around for a pretty long time. It has some cross-sectional and observational correlational evidence to suggest that it is useful for both for families and for youth health. Hasn't really been tested in some of the more traditional randomized controlled trials that we tend to think of, but has a fair amount of support for it over the years. One of the challenges with Family Acceptance Project is it's really focused, understandably, on the family. Super important part of a young person's life, and part of where we see one of the gaps here is around both interventions for youth that don't require a family to be involved or don't really depend on the family, so that youth who may not have that family support can still receive some benefit, and programs that can be delivered in schools and community settings that don't need to be delivered by more clinically trained folks and are appropriate for teachers. We've had librarians, we've had just teachers that are GSA leads want to be involved, and we've been able to see some pretty good success in implementation in that. Our program is really rooted in a minority stress and health framework. This is a theory that suggests that prejudice and stigma is really the driver of these disparities in health for queer and trans people, including young people. They include things like victimization that happens in the environment, as well as the internalization of those negative messages. Chronic exposure leads to these adverse health outcomes, including all of the behavioral health problems that we've seen. And we've done a number of projects over the years looking at both how to define these various stressors and how to operationalize them in a way that can be sort of interventionized, if you will, as well as actually some research to show that these unique stressors are indeed different from general stressors of adolescence, and that they contribute meaningfully to health. So one of the big sort of pushbacks around minority stress is people saying, well, if you have a crappy family, isn't that bad for everybody? And yes, it's true. People who grow up in chaotic families or families with violence or other things happening are more likely to have poor health outcomes. But what we see is that even when you account for that in queer and trans folks, even when you account for those differences, the presence of identity-specific stressors, aka minority stressors, has a unique influence on health. So this really tells us that helping youth cope with those stressors, as well as ideally going upstream and removing those stressors from existing in the first place through more community organizing models, that both of those strategies are really important in interrupting these poor health outcomes. So we worked on a big research study about 10 years ago or so, building out the minority stress measure for adolescents. We did about 60 interviews, which I'll talk about in a moment. We pulled a number of stressor items. Really, we were trying to understand what's it like to be a queer youth nowadays. We pulled information from that. We built a measure. We tested it with about 500 youth nationally. We found that we sort of ended up building a measure that had these 11 subscales. I'm going to talk a little bit about these in a minute. But these subscales all had relationships both cross-sectionally, so like at one time point, as well as longitudinally in our other studies to health. So what we realized was, hey, maybe rather than just going to kids and saying, don't do drugs, maybe if we actually address these mechanisms, these things that are really leading to these poor health outcomes or these mental health concerns and symptoms, maybe that would actually be a better way of addressing these health issues. So in this work, we found these are the main stressors, as well as in the measure there was also a work stress. Probably not surprising to those in the line that we do a lot of work with queer and trans kids: social marginalization, internalized homo and trans negativity, climate. Experiences around religion and spirituality. A lot of this also aligned with some of the intersectional. There's an intersectionality subscale. This is sort of trying to navigate multiple communities and trying to figure out where can I be queer and where can I be religious, or how do I do this in these different contexts. Hearing negative communication, family rejection, identity management. This is sort of figuring out when and where and how and who and if to disclose. A lot of hypervigilance that young people face every day in this. Actually having negative disclosure experiences, negative expectancies. This is sort of this assumption that if I tell somebody that I'm queer or trans, that I'm going to have a negative response, right? So that's very stressful. And as I mentioned, intersectional experiences. One really, I think, good example in this domain and things that young people of color told us in our studies were, sometimes I feel like a minority within a minority. That was a really kind of resounding description of how many of our youth in the sample in our studies really reported their experiences of being Black and trans or Latinx. So I want to just talk briefly about our development process. As I want to, when I started in this field, about 15 years ago, I came in after doing social work practice. My background was really in community organizing. For those of you that have been around a while and worked in the SAMHSA arena, you may remember the Strategic Prevention Framework State Incentive Grants, or the SPIF, process, which is still around today. I started in that kind of realm and worked in community organizing for a long time. And I came into my academic and research really saying, that's it, we're going to make an intervention, right? These young people need support, and they're in pain, and they're experiencing all these negative things, and we gotta jump in. And what I really came to realize very quickly was that when we talked about jumping in, we had some general ideas that maybe family was important, right? Maybe peers and social structures were important, schools, but we didn't really have a lot of definition around what actually mattered and what we could actually intervene on in the lives of young people. Because a lot of the research really at that time, 15 years ago, was still pretty adult-centric, right? And the experiences for these young people, for adolescents, children and adolescents, is just different. Many adults, don't feel like they have a lot of autonomy over their social environment, whether they can, say, move to another city, right? There are economic aspects that factor into that. But for young people, even things as basic as waking up each day and going to school, these compulsory environments, right? Or living with the knowledge that if you tell your parent that you're queer, that they might kick you out and you may, experience housing instability or homelessness. So there are some compulsory experiences that kids have that are just a little bit different from the experience of adults, which may happen in workplaces, of course, in other settings. But that was one thing that we really felt needed to be explored better. So as I mentioned, we did this psychometric studies. We did focus groups with youth in New York and Long Beach, as well as in some other settings. We found these 10 domains, these 10 key domains. That helped us to at least focus what each of the sessions of the program should be, since we knew that, say, internalized homonegativity and transnegativity was related to mental health or substance use. And we saw that youth who reported less of that had better health. We knew that one of our sessions should really be trying to focus on helping youth understand and cope and identify ways to remain resilient, let's say, and cope within these negative environments. We also recognized that, and young people, as we started doing piloting and acceptability testing, the one great thing about working with adolescents, for those of you that do, is that young people are never short on opinions, and they're always willing to tell you about all the things you did wrong, which is awesome, and really helps to make sure that the programs that we're doing, I think, are responsive to their needs. One of the big things that came out in our piloting acceptability trial was that they said, it's great that we can come together and we can talk over these 10 sessions about the things that happen in our lives, talk with each other about coping skills. We love that. It's really great, but it's hard for us I think it was described, this young person said, it's unsatisfying to know that we still have to go back into this environment that created this problem in the first place. And while it's important that we are able to cope and have these skills, how does this help us actually change the environment that made this a problem in the first place? And I was really struck by that. I think that was a really critical and important piece. And for me and for our team, I think it was a space where I was able to go back to some of those skills I had learned in my own community organizing and practical work, and bring those forward into some intervention development. So during our feasibility studies, which are published in our public access, you can actually find pretty much everything that most of what we have on is all on our website. So I just put that in the chat just so folks know, but you can get access to all these publications and all this research from the website, as well as go there to request information or copies of the curriculum. Curriculum's totally free. Y'all already paid for it when you gave your tax dollars to the NIH and they gave them to us. So as far as we're concerned, all of this is public access. But so anyway, so this is where really in this piloting and feasibility stage where we added in the second component, which is the school-wide community organizing model called Make Space. In our early randomized trials, we had good findings showing that that those who participated in the intervention found lower symptoms of anxiety, of depression, PTSD symptomology. They also reported higher coping and resiliency. The way we looked at resiliency, I'll mention, I'm trying to describe this, is basically what we found is that youth who went through the program, they did generally report fewer minority stress experiences, right? They did say, yeah, I was actually able to avoid these experiences between their pre-test and their post-test. At the end of the program, they did report fewer. But the other interesting thing that we found is that even when the youth in our study experienced higher rates of minority stressors, they still reported better mental health outcomes when compared to the youth who didn't get the program. So what this suggests to us is that they did build some coping skills and build some resilience so that when they were exposed to minority stressors, that it was less likely to be internalized and have that effect on their mental health. We're also currently in the middle of an RCT. We're working with 24 Southern California high schools on this. We're actually a bit higher than 24 in our plan now, where we're looking again at the implementation of Proud and Empowered. Of course, the outcome, it's an outcome study, as well as some implementation factors. I do want to mention before we get into the curriculum that this program was designed in parallel, both to be used in schools as well as to be used in more community-based settings. And I love your question, Cassandra, about the RCTs in rural areas, because I'm gonna hit on that a little bit. We have some additional resources. Let me say, I'll say a few things and then I'll get to that question. So the study really has these two components, or I'm sorry, the intervention really has these two components. We've got Proud and Empower, which is this 10-session intervention, and the second piece is Make Space, which is a 4-session leadership program. And in this program, so generally how schools or community organizations have worked on this is they've, in schools at least, is they've identified queer and trans youth that would benefit from the sort of 10-session program, right? The small group program. And then at the end of it, they work with those youth to say, hey, if you're interested in staying and interested in continuing to do some work, we're going to work on this program, Make Space, which is more to change the climate, right? To work on the school, to think about the climate. They do an assessment following that tried and true Smith model. They do an assessment of the school. They identify capacity. They're provided with a list of evidence-informed strategies for things that we know are helpful and can work in improving school climate, right? Education for teachers, safe space training, better school policies, access to gender-neutral restrooms, right? There's a number of things that we know help with the social environment. And they actually identify youth in their school that are seen as leaders, right? That are seen as popular opinion leaders. And those youth, whether queer and trans or not, are invited to join with the queer and trans youth that work through Proud and Empowered to work together on the rollout of these programs in the spring. So generally, P&E is done in the fall. We do the training of Make Space. We identify those allies. In the fall, we bring them in. We do the training of Make Space between the fall and the spring semester, and then the whole spring is really spent doing social action and following that. One of the reasons why we actually chose to do some testing of these programs a little bit sort of in tandem, but separately from a research point, is in part because of our interest in really trying to expand this program and work in more rural areas and beyond sort of the larger cities. I personally recently made a transition. 2 years ago, I left USC in Los Angeles and moved to Washington University in St. Louis, which is a city, but a much smaller city in the Midwest, certainly much smaller than Los Angeles, and has a much stronger access and reach to our underserved rural communities, which are really, I think, a critically being left out of the narrative. And honestly, for most research in queer and trans health, it's coming from New York and LA, San Francisco, and maybe a bit from Chicago. But outside of those sort of major metro areas, there's really not a lot happening. So a big part of our goal in sort of breaking this up and not making this all just one piece is in part because we understand that as we're working with more rural areas or just more states with that are, tend to be more conservative in terms of queer and trans health. My own state, Missouri, just let a law go into effect this past week to eliminate access to gender affirming care for kids that are transgender under 18. And so, I myself am very much involved in working with our university system and our state and how we think about providing care within the context of evidence-based medicine. But we understand that some of these programs are going to be, parts of these programs may be really hard because of the climate that's occurring in some spaces, that some places may be, yes, I've also lived in Houston for a long time, so I've been following Texas. So we know some spaces are going to be able to maybe do a P&E, right? We know that some folks are going to be like, look, I can get my school to allow me to do this, or I can do it during the GSA, or I can do this in a community-based setting at like a drop-in center, which is another place that we've actually built a lot of this and really have tested it. But I'm not really sure I'm going to be able to get my school on board with doing this broad, social norm, social change intervention, right? Like maybe that's a goal we want to work towards. But we want to know, is P&E okay if we do that and we can't do Make Space? So we have found that P&E does work independently of Make Space, and that Make Space can be done kind of as a separate module or a separate program from the main kind of 10-week program. And we are testing it currently with a bunch of other types of settings. We have some folks working with us. Again, it kind of came out of more drop-in settings, although some of our RCT work has been in schools, just because it's a little easier to monitor the students, right, staying in. And drop-in settings can be a little complex, but we have built it in a modular way so that it can be implemented in other types of settings. And we are working with a number of community orgs around the country to implement this now. So, okay. So P&E, as far as we know, one-of-a-kind program, allows youth to discuss their experiences around bullying and victimization, experiences of minority stress, working to build coping, resiliency, and support networks. Support networks is a huge part of this, and to plan stress management. One of the reasons why we built this in sort of with drop-in centers and other types of settings in mind is because many different drop-in centers work kind of in different ways, and some have more formalized interventions and others may have less and really serve truly as just drop-in spaces. One of the things that we have found is that in those spaces where a lot of times the people that are running those programs actually would love to be able to implement something, right? They would like to have a program that gives you a little bit more structure, right? Or maybe some of the time is more, free to roam, free to choose, drop-in space, really focused just on safety and creating a space of safety. And maybe some of the time is a little bit more program and actually allowing youth to have those opportunities to work with each other. And one of the things we've really found with this is that in addition to the skills that are directly conveyed that youth are reporting, that they stay in contact and that they've maintained some of those support networks. I think because of the architecture of the program and the ability to actually have these kind of deeper relationships that are informed through the program. Each session works through one of the 10 domains that we mentioned before. Generally, we suggest around 8 to 12 youth attend. For those of you that have, are better at large groups of adolescent management, bless you. I could learn a lot from you, I think. Maybe you can run a group with more than that. We've generally found that about 8 to 12 youth is 12 youth is kind of around where it's been a little bit harder to keep the group cohesion going. The sessions run, they can run anywhere from about 45 minutes to an hour. We've found that we generally can fit them within a class period. And we've also found that in some, in non-academic settings, non-school settings, that sometimes people want a little more time because some of the activities they want to like allow the space to breathe a little bit more, and don't feel like they need to be as tied to the time. So generally 45 minutes is a pretty good time. If you have an hour, that also tends to work and allows people a little bit of extra wiggle room. Make Space, as I mentioned, is an indirect program where we bring in these popular opinion leaders. The queer and trans youth help identify those peer allies. They review findings from they look at the school climates, they look at data that exists about their school district. Sometimes this comes from the Youth Risk Behavior Survey, or if your state has county or state policies. In Texas, when I worked for DSHS, I used to help run or be very involved in the surveys in Texas. So many states have their own version. California Healthy Kids Survey, or Oasis's survey in New York. So they review those kind of findings and conduct policy scans. They're trained in social action and community organizing. They develop that strategic plan and implement those strategies to the spring. And then we generally help to provide some guidance for them around how to evaluate the success. We also provide them and the popular opinion leaders with certificates that they can use for letters for college essays and things like that. A lot of youth have asked for that because they found it really helpful. So again, I mentioned the real goal here is that interventions for queer and trans or sexual and gender minority youth really need to simultaneously help the youth themselves, while also working to reduce the likelihood that future victimization is going to happen again. And so we use a set of strategies that are evidence informed and kind of available in the literature. And we let the youth kind of identify what strategies they'd like to focus on and help provide some guidance on how they can move that forward. As I kind of alluded to or mentioned before, we're expecting this to look a little different in different settings. So we try to provide a menu of options, let's say, so that if your school is ready for, if you're in an area, an urban maybe setting with a high level of readiness, maybe they're really ready to do kind of the whole shebang. And if you're not, if the school's not ready, the leadership's not ready, there are some options for like kind of getting started, right? For those of you again that have been kind of doing this kind of work, we know that increasing readiness, right? Change is a process. It starts with sort of increasing awareness and readiness, and that can be really important. After a few years of that, we've seen definitely progress with school administration feeling more on board with doing more. So the popular opinion leaders are generally peer allies. They are identified through the, we've done it a couple of different ways, both through school survey, where you basically say to students in the school, you have a survey that just says, who do you go to in this school for advice? And it's a really open-ended question. And then you basically just amass the list of kids and you see who are the most popular people, right? These are the people that are kind of seen as the most trusted advisors. Really, this notion for us was a way for us to try and operationalize allies in a way that's not just about that you support queer and trans, friends, or you are like sort of, like kind of a self-described ally, but also that we want to have these young people thinking about strategy, and who are the allies that also have influence in the school, right? So yes, we love our allies that are, that are in our GSAs and are really close friends and are really good, support systems. But sometimes those youth aren't necessarily the same synonymous with the influential youth in the school, who, say the student body president, and those kinds of people who have put themselves in more leadership positions or been elected by their school, by the student body, to put them in positions of power. So when we either do this through survey, although honestly what we found is you get almost the exact same list of names when you just ask the queer and trans youth in P&E, who do you think are the most influential people in the school, tends to get you basically the same result. And we work with the school counselor to go to those young people on behalf of the P&E group, the queer and trans youth, and say, hey, we're working on this project and you're a really influential person in this school, and we'd really love to have you on board in partnership with our queer and trans youth to sort of make some of this stuff happen. And we generally have fairly good success. Again, those meetings are done confidentially, so I don't want to get too far in the weeds, but whoever's facilitating the group in the school generally has those meetings confidentially so that those youth also can say no. The young people generate a longer list than they need. So if they really want 5 kids, they'll give a list of 10 or 12 so that it's not clear if somebody actually just said, no, I don't want to do that, versus, that they just weren't chosen. So the counselor, whoever's running the program, generally approaches those youth independently and confidentially, tells them a little bit about the program, asks if they would be interested in, in sort of taking a position and really kind of, being a champion for queer and trans youth in the school. And if they say yes, then they're invited to participate in the 4-session group. The very first session does have some setting expectations, helping people understand what it means to be an ally, right? How do you take how do you know when to drive and when to sort of take the back seat, and how do you understand, how to be a support and not speak for people, right? There's a lot of dynamics in allyship that we know can that are complicated, right? Allies are a super important part of changing social norms and messaging and policy, but they also need to sort of know when it's time to kind of listen and learn, and know when it's time to try and take that initiative. So we do spend a fair amount of time in the first session really helping our popular opinion leaders, or basically our allies, that have been chosen strategically because of their influence in the school, to participate. And we haven't found too many issues with this, not really any issues with the PLLs and the queer and trans youth working together. Generally with a good facilitator, it goes pretty well. All right, so yeah, we hope that the support piece is really important. There's something that I think really to say when young people, of course, just are around each other and hang out. That's great, but there's a depth to the relationships that I think you can really see when they start to go through these groups around the 4th or 5th session. You can really see the dynamics shifting in the way that young people are working with each other, checking in with each other, asking, about things that came up in previously, right? There's a sort of a depth to the relationship that you see forming, and I think it's a byproduct of the program. It's not necessarily that we are instructing them to do that. It's just by the nature of having the opportunity to be together and share this space and talk about these kind of difficult things, people become closer. So affirming youth and their experience, offering empathy, resiliency, and community again, and really trying to take a strengths-based approach. This is a pretty important aspect to it. I will mention this is not a family intervention, and so there are certainly things that we see that young people come with, problems that can't be solved, that we can't necessarily fix for them, both in the family, if they have challenges in their family around acceptance, or in some cases in schools and peers. We work with connecting us to resources. Of course, there's a lot of monitoring for that, but ultimately there are pieces of young people's experience that are not necessarily addressed by PD directly. I will say, as I mentioned before in our early research around PD, we did actually see. I was a bit surprised, honestly, to see a reduction in some of the minority stressors that centered around family and in other like that form of distal victimization. We did actually see reductions at post-test for kids that went through the program, which suggests that they identified at least some way to avoid or steer clear of those experiences, maybe becoming more aware about them, allowed them to figure out better ways to talk with their family to at least avoid stress. So I'm not saying that the stressors necessarily went away, but it appears like youth who go through it at least maybe identify some strategies to avoid. All right, so I just want to talk through just a couple things about the curriculum, and then with our last about 20 minutes. And feel free to keep putting, I should have said this earlier, feel free to put your questions in the chat. If I see them and I'm able to kind of address them in the moment, I'm going to do my best to keep doing that. If I skip over it, it's not because we don't see it. It might just be because it's a little bit of a longer explanation, and I'll save time at the end for that. So there's a lot of activities in our program, and a lot of didactic. We try to mix up every session to have a lot of different types of activities. Generally, we've worked with this program with 12 to 18-year-olds, and of course, as all of us are in session one, everyone's grumbling about a group activity. I feel fairly confident that if I put a group activity up on the screen, that many of you would feel exactly the same as our young people feel during session one about being, sort of dragged into it. But just like in group experiences like this, as people loosen up and they start to feel more comfortable, they start to get more invested and more interested. So we've got a number of different activities that we do along the way and are kind of integrated through the sessions. Our first session really on getting to know each other, helping youth to understand the program and understand their fears and concerns, guidelines and safety, confidentiality, right? All of these kinds of things. And we start to build cohesion through an activity called common threads, which is where with a ball of yarn or other way we'll sort of connecting youth on their shared experiences. We also talk a lot about common messages that are held by people about queer and trans communities. We start to talk about some of this because a lot of those internalized feelings, we see that in other literature, not ours, really shows a connection between hearing that negative messaging and internalizing that negative messaging and starting to believe that about yourself. So all of our sessions will cover various aspects of this. In this one, for example, we talk about messaging that people hear about queer and trans folks. We also integrate a lot of history to try and help push against some of that, right? So some of those deteriorating ideas that are held about queer and trans people, we also try to offset that with some of the wonderful accomplishments that queer and trans folks have had throughout history. We talk generally about stress and coping. A lot of young people haven't had really a lot of opportunity to think about what stress even is. What are the coping strategies they use? Again, we do our best to take a non-judgmental approach to coping. Most of us, didn't have the opportunity to learn specifically about healthy ways of coping when we were young, right? We just learned how to cope. We learned what worked for us. And a lot of our coping is built on just kind of survival. And whether those coping strategies are working for you or not, that's a very personal decision and a personal journey. And I know I can speak for myself, now in my 40s, I'm spending a lot of time thinking about the ways that I've coped with a variety of things in my life and whether those things are still serving me even if they did at a different time. So we spend a lot of time in session 2 talking about this, thinking about causes of stress, how to identify our feelings, how to express ourselves effectively to others. Session 3, we talk about coming out. Big focus of this is about who can we come out to? How do we do it? Is it safe, right? A lot of discussion around, is it safe? And what are the sort of benefits and drawbacks perhaps of coming out? Again, in a non-judgmental way. We know that there are many mental health benefits for around disclosure, especially around internal sense of self. But there may be some really very real consequences for young people in coming out, especially if they're worried that their parents may push them out of the home, right? And they wouldn't have a place to stay, or it might increase their likelihood of violence or victimization. So we allow, again, it's in a non-judgmental space to talk about decision-making processes and how youth can think about when they come out, what are the possible outcomes, and how to handle those different situations and just be prepared as they walk into those conversations. We also generally have an important conversation, I think, around telling parents and helping young people think about how they set expectations for how their parents may react. I often say, when a person comes out to their parents, usually they've been thinking about that for a really, really, really long time. And some parents may have been thinking about that for like 30 seconds, right? And that's the first time that they're really thinking about that. And often when we're caught like that, we don't always respond in the way that youth might want, right? Because they've really spent a lot of time practicing that. So there's a really important aspect of that, of thinking about, again, not to say that it's okay for your parents not to wrap in support, like we want, that's the goal, but also just to help sort of set some expectations about what that might look like, and how to navigate those kinds of conversations if one makes the choice to do that. We have a session on family and social networks. We talk about family stressors. We talk about distant relatives and the sort of social network. We talk about families of origin and families that we choose, that we build ourselves, who we get support from and how. There's an important activity here also thinking about that you can't get everything from everybody, right? So how do you think about who you go to for different things? How do we be more strategic in our families, in our social relationships, to get the kind of support that we really need based on what we're going through in the moment? We talk about peers and relationships, both, again, trying to what are the characteristics of positive friendships, positive relationships? How do we build healthy connections with folks? How do we set boundaries with people? How do we think about consent? Consent's a really important aspect of our work, both within the context of intimate partner violence and some things like that, but just in the ability for young people and people to learn how to set boundaries, right? How to obtain consent for all sorts of things in relationships, whether they're romantic or not. We talk a bit about career planning and people's feelings and stress around being queer or trans, and their thoughts about how that might affect their future and their livelihood. We have a section on religion and spirituality. We think about this very broadly and try to be inclusive around different types of practices and experiences. Historically, I've done some work with religious communities of queer people and saying, I feel like I'm being forced to choose. I either have to choose my queer friendships and my queer identity, or I have to choose my religion. And it's not just the religious community that's asking me to make this choice. So we spend a lot of time talking about openness and willingness to experience spirituality broadly, to allow other queer and trans folks to experience this in the way that makes sense for them in a non-judgmental ways. We have a session on social justice and advocacy, thinking about power and privilege. We talk a lot about the experience of power and privilege within different intersecting identities, positionality, and we have a number of activities that focus on this. We have a session on queer and trans health. This includes things like advocating for oneself in medical settings, knowing your rights around what you can tell doctors and what might be shared with a parent or what might be shared and what shouldn't be. We have a fun game on sexual health bingo, which has been interesting, I think, in a nice way of doing some of that education in a way that that youth are less resistant to, if you will, because this, a lot of times the setting in which we talk about sexual health, substance use can be really sterile. And I think, so we try to make this a little bit more fun. And then we have a whole session on queer and trans history, talking about many queer and trans moments in history. We have a Jeopardy game that they play, and we do a final kind of celebration. So I'll talk briefly about Make Space, and then I'm gonna close so we can have a little bit of time for some questions. So again, we do 4 sessions at Make Space. The first session is really about team building exploration. I mentioned earlier, talking about setting expectations for allies in particular, helping them think about how they would work with each other, talking about activism in general. Session 2 is our needs assessment, and I won't go into too much detail in this, but we have a variety of ways that youth can identify, can try to build a needs assessment that's rooted in hopefully the evidence that they have available to them from their school. The third session is around building capacity. So this is where they really talk through what's possible, right? This is really an important session because there's all sorts of things that we'd love for youth, or that youth would love to be able to do. And at a certain point, we have to sort of have that conversation, or they have to be able to have that conversation with their leadership, administration, with teachers, whoever, and figure out, all right, where can we meet in the middle, right? How can we make some progress here within the confines of, the administration that we're working in, or the school that we're in, or the community that we're in. We're having a lot of challenges right now. For example, we're working both in Burbank High School in Los Angeles and in Glendale. We are working in Glendale, and we're working with Burbank. Both of them have had really huge issues recently around, it's been sort of the center point of a lot of news and sort of hype around experiences for trans kids in particular, and their experience in school around what needs to be disclosed to parents about what's happening for kids. And we've been really censured in that with them, and trying to work with them. And these schools are very interested and want to do things to support their young people, and they also have school boards and parent boards and all these things that are happening, and they're having to navigate, right? How do we thread this needle with making sure that we're showing our support for our youth, and also how do we figure out how to do this in a way that protects the system, protects us, right? And make sure that we can continue next year to provide these services. We don't make we hopefully push these folks, we don't make the problem worse, I guess, is sort of, that's a balance that they're having to strike, and it's laudable. They do strategic planning, and this is where they come up with the plan and the timeline for the rest of it. They present the project plan to the leadership at the school, and then they're able to move forward, and they spend the rest of that semester doing that. So I know I raced through that. I want to allow for some questions. Thank you, Lindsay, for mentioning this. Corey, I see your message about getting involved. The best way to get involved, there's a couple. One is on the website, there's a place where you can submit for more information. That is the best place for getting in touch with us. One, we will work with you on whether you want to go through the more comprehensive sort of training on it. We can talk with you about what your setting is, your situation, what you'd like to do. We have an opportunity to then go through some training. It's not required, but it is recommended. It's a brief short virtual training on the program. We can provide you all of the curriculum materials. We also can provide additional TA along the way to folks who want to implement the program. We have some funding to do that. Then we actually have a limited amount of resources to help provide some support for if you're interested in doing some evaluation of the program. We love to know if it's working in diverse settings and whether it needs to be adapted. And we do have some resources that are available to support both your implementation of it in whatever setting you're working in, particularly if you're working in more rural or underserved communities, and that to support both the facilitators' time as well as for youth incentives. So the website is really honestly the best way to get in touch, because that's how you get connected to our whole team. My email is also on here, and you're welcome to email me, and I'm happy to try and provide support as well. And Lindsay and Jessica are amazing. They're keeping up with all of these phenomenal resources.
Cassandra has a question about just the, how can someone get trained? It sounds like their audio went out and they might have missed it.
Yeah, no, just submit a request through the website, and that's how we'll connect you into the system and get you set up for training, figure out what your needs are in your, the sort of setting that you're trying to work in, and we'll get you connected in. We don't charge for anything. Our philosophy, we published all of our research in open access journals, because that's another sort of the paywall is a big problem. Our belief is that these are resources that were paid for by tax dollars through the NIH, including like this webinar, for example, is also being paid for by y'all. So you already own this program. I'm just the sort of keeper of it, I guess, or the keeper of the website. I just pay the GoDaddy bill. So I'm very much a believer that that this is already yours. We want to try to make sure folks get trained to the best that we can, and then we'll provide the resources to everything.
Another question came in. Do you have a training for parents on Zoom?
We do have some training depending on the sort of specific needs of parents. We have some folks that work with us that do training for parents, in particularly around working through their own experiences of raising transgender youth in particular. So we do have some opportunities. We have some folks that work in our center that do work with parents.
That is wonderful. I'm just going to ask you to go to the next slide. There's one thing that I just want to let folks know about that's coming up. We're pretty excited about our fall series on working with LGBTQIA+ clients. It's going to be a 3-part series. We're going to have a webinar October 11th, National Coming Out Day. And then part 2 is going to be a panel that has a really a wonderful group of folks that are working in rural areas in different parts of the country. And then we're going to have a collaborative learning session. So those of you who are asking about rural spaces, we're hoping that will be a place that you can bring your questions and also meet others who are having similar challenges. And we're also going to have some folks there to provide technical assistance as well, just to kind of share experiences, tips, strategies of things that people are implementing. So thank you so much. And there was one more question I think that came in while I was talking about that. Oh, how could parents get the information for that training?
Yeah, I put in the chat, just you can either email me, I put my email there, or if you just submit an info request to the Proud and Empowered website, that'll also make it to our team, and we can get you set up.
That all sounds wonderful. And thank you all so much. Thanks also to Jeremy. This was really great. I love hearing about this program and also just how accessible it is. That's very exciting.